My name's Amazat Barida. I'm one of the children's doctors, one of the specialty registrars, and I've been asked to have a look at Luca's abdomen. Hello, Luca. How are you? Is it okay if I can examine his tummy? Perfect. Luca, are you in any pain today?
No.
Do you need to go to the toilet?
No.
Excellent, good. And how old are you?
I'm 11 years old.
You're 11, excellent. So what does that mean, that you're in year 6 at school?
Yep.
How did I guess? Brilliant. Now, firstly, Luca, could I get you to take your top off for me? And if Mummy could give you a hand, if we could have your trousers off. Yes, please. And could you take the trousers off as well? Just leaving the underwear on, that's perfect. You're not too cold, are you, Luca? Do you want...
Sometimes I do get cold because... Sorry. Hold on.
Sit.
We've got a blanket here if you
Good
need
boy.
it. Do you want a blanket?
Let's do that. You might get a
I actually do like blankets.
Excellent. Oh, sorry.
Don't like it being a bit too long exposed.
Okay, perfect. Firstly, Luca, can I have a look at your hands for...
Sure.
Brilliant. And your other hand. And can you go like this for me?
Okay.
As if you were stopping the traffic lights.
Like that.
Brilliant. Excellent. I'm just going to feel your pulse. And can I get you to look that way, over there? And just lie back for me. Put your head right back. Perfect. And I'm just going to have a feel under your arms. Are you ticklish?
Yeah, very ticklish.
Excellent.
Especially my feet part.
Oh, I won't tickle there then. And can you look up for me?
I don't like having my
Oh,
down.
can you do that for me then?
Is this...
That's better. Yeah, a little bit further down.
I can't do it.
Oh, that's okay. Don't worry. That's all right. And can you open your mouth and go, ah? Perfect. Excellent. Good. And is it okay if you just sit forward for me? I'm just going to have a feel of your neck. Okay. I'm going to have a look at your back. Oh, I can see a couple of scars down there. Okay, good. And do you want to lie down? And I'm going to find a way to try and get this bed flat. I don't know if Mum could help me. Perfect.
Well, laying down too flat.
Is that okay?
Yeah,
Let me know if you're not comfortable. Okay, good. Now, I'm going to press on your tummy if that's okay. Is there anywhere that hurts?
Maybe near my peg
Okay.
because it's like been in...
For a while. I'll make sure I won't go near there.
Oh, I can...
I'll be very gentle.
Oh, jeez.
Oh, sorry. I'm going to press a bit more firmly, okay?
Oh, that's nice and relaxing, actually. My peg,
Oh, sorry. I won't go near there. Good. Okay. Now I'm just going to feel here.
Okay, in my...
I'm just going to feel there. Okay. Sorry. I do apologise. Now, I'm going to tap on your tummy, okay? But before I tap on your tummy, I want you to breathe in and out for me. And again. Good. Okay, same thing again. Breathe in and out for me. Good man, sorry. Okie dokie. Now, bit of tapping.
That gives me the urge to belch.
Oh, does it? Oh, don't worry about that.
Okay, that is a bit too high.
It's a bit too high.
Yeah. Okay.
Sorry, that's all done. Okay, excellent, good. And I'm just going to have a little listen, if that's okay.
Okay.
I'm just going to listen around the back as well.
If you hear like, if you hear like Well, that's because my stomach's got some food inside and it's digesting it.
Oh, okay, yeah, I could hear your tummy gurgling away.
Yeah,
Can I have a look at your legs?
Pom-pom bears earlier on.
They sound very tasty.
I did have a chocolate biscuit as well,
Mhm.
marshmallows.
Perfect. And I can see your nails. And have a look at the soles of your feet. Fantastic. Great. Shall I cover you up?
Okay, would you like to present your findings, please?
Sure. So I examined Luca's abdomen. He's an 11-year-old boy. He appears small for his age in terms of weight and height, but I'd like to plot that on a growth chart. On examination, he had clinical findings consistent with a child with chronic renal disease who is on hemodialysis, as evidenced by a double lumen central venous catheter and bilateral transverse scars on his back in the renal area that could be consistent with nephrectomy scars.
Yeah.
In addition, he also has a PEG site on his abdomen, and I did note that he did have bilateral toenails which appeared hypertrophied with Bowes lines on them, possibly suggestive of some form of chronic inflammation, possibly associated with chronic renal disease as well. My differential diagnosis would be renal failure requiring hemodialysis and bilateral nephrectomy. There is a whole range of conditions that could lead to this, which include congenital anomalies such as multicystic dysplastic kidneys, polycystic kidneys, posterior urethral valve requiring nephrectomy, or glomerulonephritis as well.
Okay, thank you very much. Is there anything else you'd like to do in your examination that you weren't able to do?
I'd like to check the blood pressure. I'd like to do a urine dip. I'd like to check the external genitalia as well.
Okay. Now, you can see that he has a permacatheter, which you correctly identified for hemodialysis. How would you know if this child needs hemodialysis today?
In terms of if he was due to have a...
I mean, are there any signs that you look for that would suggest that he's actually needing hemodialysis straight away?
Straight away. So, for instance, if there was evidence of volume overload, if there was breathlessness, ascites, if there was evidence of pulmonary edema and crackles at the bases. In addition, if there were kind of clinical signs of hyperuremia, if he was confused, for instance,
Right,
or very pyritic.
Okay. Now, you've seen that he's had both of his kidneys taken out. Why would you want to do that?
So indications would include congenital disorders such as multicystic dysplastic kidneys, where there's a risk of infection there, especially if there's incomplete involution of the kidneys.
Yeah.
In addition, as a bridge to if there's been a transplant in the past, then nephrectomies can be used to create kind of more anatomical space as well. And in terms of risk of infection, when you have structurally abnormal kidneys and recurrent urinary tract infections, then that is an indication for nephrectomy.
Okay. Now, how would you plan to manage this patient going forwards from here?
I'd like to consider kind of biological, psychological and social factors and include the multidisciplinary team. In terms of the management of his chronic renal disorder, because we're uncertain of the etiology, I'd want to do a full set of kind of baseline investigations, including renal function, vitamin D, parathyroid, an FBC, erythropoietin levels as well. I would like to check blood pressure, have a look at his urine protein creatinine ratio. I'd like to image the kidneys as well with ultrasounds, possibly use of Dopplers or MRI angiography if necessary, depending on the underlying etiology. Depending on the history, I may want to consider autoimmune causes for an underlying glomerulonephritis.
Right.
So including investigations such as ANA, ANCA, C3, C4, ASOT, but that would be guided by the history. In terms of kind of the management side, I'd like to involve a consultant nephrologist at a tertiary centre. I'd like to involve a local paediatrician in a district general hospital, a nephrology specialist nurse. Management will be guided, and possibly a paediatric urologist as well. Management will be guided by the underlying etiology of the kidney disorder, but would involve immunosuppression in the context of glomerulonephritis, renal replacement therapy such as dialysis or transplant if there is a renal pathology that can't be reversed, and also supplementation of hemoglobin, possibly using erythropoietin, and consideration of endocrine complications such as hypercalcemia by monitoring of calcium and parathyroid hormone. In addition, with growth, chronic renal failure and poor growth is an indication for growth hormone, so possibly involving a paediatric endocrinologist as well.
I'm afraid we have to finish there. Thank you very much indeed.
Thank you.
Yeah, the first candidate was very good, actually. I particularly enjoyed the way that he took command of the situation. He looked like a doctor. He looked in control of the situation. He was very good with the mum and the child as well. He conducted a very thorough, by the textbook, examination of the abdomen, and that worked very well. There were a few things that perhaps I'd have liked slightly differently, because quite early on he worked out this was a renal examination from the permacath that was situated on the chest, and also from the nephrectomy scars. And nephrectomy usually means the kidney's been taken out. So the big question for me was really, does this child need dialysis? Is there another kidney in there somewhere? And actually, how's the child managing without that? Another question might be, well, what were the kidneys taken out for? Now, of course, you could get that on history, but there might be things you could see on examination as well. So, there were a few comments a little bit later on about, the urine. Obviously, there's no urine, there's no kidneys at the moment. I think a more thorough examination, perhaps, of the groin, which is where a new kidney might be placed back in, might have been appropriate there. Perhaps he quite quickly worked out there was no scar there, but I didn't really get the impression that he was looking for that specifically. Moving on, looking at the abdomen, I think it's very important as in general inspection, rather than immediately going in and starting to feel that. And that's something you can do in an examination and in real life as well. Is actually spend a bit of time really closely studying the abdomen, seeing how it moves, looking for asymmetry as well. So that's something that I would advise him to do next time. Perhaps the last thing is specifically offer to measure the blood pressure, which I had to actually ask the candidate if he would be interested in doing that later on, because obviously that's such an important thing in the assessment of the kidneys, and also looking for a peripheral edema and sacral edema as well. But overall, I thought he was a really good candidate. His questions were really answered very well at the end. He presented a really neat summary. I'd be proud to have him as my registrar, and so it'd be a very easy pass.